Hi, I'm Kirsten Delgado. You're watching WCI-TV, brought to you by Tower MSA Partners, and I'm sitting here with the Director of Clinical Operations for HeadsUp Healthcare, Stacie Haines. Thank you so much for joining us, Stacie.
Thank you for having me. It's good to be here. I appreciate the opportunity to be able to talk about a topic that I am truly passionate about. For most of my career, I've spent working in the oral and maxillofacial surgery arena as a surgical tech, and for the past 10 years, the last decade, I've been had the privilege of working with injured workers with complex injuries, dental injuries. So that's been super fulfilling for me. So
I love that. So you got to love someone who loves what they do, right?
Absolutely.
We've been talking a lot about different variety of injuries here, knee injuries, back injuries. I think when we think workers' comp, we think of those things, but dental is a very specific injury that can be a part of workers' comp. Talk to me about when we're looking at a dental claim. It can look very easy just on the surface of it, but there's a lot of complexities happening there. Talk to me about the professionals at HeadsUp and what they're seeing that maybe another insurance professional might miss in that claims document, specifically for dental work.
Yes, you're exactly right. Most people think dental claims are simple. A broken tooth, it gets fixed, or a tooth knocked out, it gets fixed, and everyone moves on. But in reality, dental claims often present with pre-existing conditions that we have to deal with, competing treatment philosophies, causation questions, multiple specialists, and believe it or not, they can present with significant financial exposure as well. So, most people see a broken tooth, we see everything that comes with it.
So talk to me about HeadsUp being the middleman, right? You're kind of the bridge here between the injured worker, the claims professional, and the provider. Talk to me about the importance of being that role, playing the role of the bridge and actually moving the claim forward.
Yes. I often describe HeadsUp Healthcare as standing in the gap. And what I mean by that is standing in the gap between the injured worker, the treating provider, and the claims professional, because our role is to make sure everyone has the information they need for the claim to move forward appropriately and efficiently. Every day we're bringing together injured workers, providers, nurse case managers, adjusters, care coordinators, clinical reviewers like myself to ensure the injury, the treatment that's being recommended is related to the injury, and that treatment is moving forward in a timely manner, and that the focus is on restoring the injured worker. So we simplify the complexities, we bring clarity to where it's needed so that, everyone experiences the best possible outcomes. That's what standing in the gap means to us. We're not just here managing referrals. We're actually here to help manage the best possible outcomes. That's what it's about for us.
Let's go deeper into that. Give me the kind of A through Z of what happens about how HeadsUp, handles a claim. Talk to me about the A to Z, of that.
Yes.
Yeah.
I always say great care starts with great coordination, because that's what I learned through my many years working in surgery. But our care coordinators have decades of experience, combined experience working in dentistry as well as oral surgery. They're not just call center staff. They're trained clinicians. Our clinical review team alone has over 100 years combined experience working in the OR alongside oral and maxillofacial surgeons, managing everything from broken teeth to jaw fractures to TMJ injuries and a lot of facial trauma. So we understand how trauma presents. We understand the injuries, we understand the treatment pathways, we understand how these cases are managed in real time, and we also understand what the injured worker is facing because of our firsthand patient care experience. So when a claims adjuster reaches out to HeadsUp Healthcare, they're not just getting a coordination team. They're gaining access to an extraordinary level of clinical knowledge and experience. So manage a claim from start to finish and making sure, the goal is never to deny or, approve or deny treatment. Our goal is to make sure everyone has the information they need, because you have injured workers, you have nurse case managers, adjusters, providers, employers, all looking at the same claim through different lenses, right? So, at the end of the day, success is about helping people move forward, right? So for the injured worker, it's about making sure that he's getting, or he or she's getting treatment in a timely manner and restored to function. For the adjuster, it's all about having the information they need to make informed decisions with confidence and not to add layers of confusion.
Right.
Because what we do is we translate dentistry into plain English. And so it's our job to take complex clinical information, translate that into practical guidance so that everyone achieves the best possible outcomes.
Certainly a tall task, but y'all get it done.
Absolutely.
Stacie, thank you so
love
much for
it.
your time. I appreciate it.
Thank you so much, Kirsten. Good to
course.
be here.
You're watching WCI-TV, brought to you by Tower MSA Partners.